Hi, welcome. I see we have you in for your annual physical exam today. Please come on in, have a seat, and we'll get started. So let me just check your chart here. It's been quite a while, my friend. You know, even as a guy, you do need to get to the doctor at least once a year for a checkup. And I have you down as 3 years past due. So we are going to have to do quite a thorough exam today. So, why don't we do a little history, since it's been so long since you've been here, and then we'll get into the exam. So, any changes over the past couple of years to your health? Anything major, heart issues, lung issues, any pain, sleeplessness, overstress, depression, anxiety? Okay. And how's that diet been? Pretty healthy, I hope. Okay. And how about your alcohol and drug consumption? Low to none, I hope. Okay. Well, a couple of drinks a week is okay, but really do try to limit it. You are not getting any younger. Okay. And how's work going? Stressful. And is that impacting your day-to-day life in any other capacity? Okay. Alright. How about any recent injuries, surgeries? None? Okay. Any new medications? Okay. And how has your sleep been? Not too great. Alright. And anything else that you want to tell me? Okay. Alright then. So, there's a gown on the table there. Why don't you put that on, and I will be back in a few minutes to continue the exam. Alright, my friend. Now that we have you gowned up, I'm going to be going over what we will be doing in the exam today. So this will be a head-to-toe physical assessment, including looking at your eyes, ears, mouth, nose, as well as taking a listen to your heart in a general physical examination to make sure everything is in proper working order. Sound good to you? Wonderful. Alright, so to begin, I'm going to take your blood pressure. I have my blood pressure cuff right here. So I'm just going to ask that you hold out your arm for me. And we're going to get that all wrapped up. Good. Let me just grab my stethoscope so that I can listen properly. Okay, my friend. So you're just going to hold still for me while I pump up the cuff, okay? Just hold still. Alright. And let that go. Wonderful. Blood pressure looks great. Let's get that cuff off. Great. Alright. So the blood pressure looks good, which is very promising. Don't like to see high blood pressure in my patients. But if you'd be so kind, just give me that arm again. I'm going to take your pulse, so just be quiet, be still. And let me have that arm. Wonderful. Your pulse sounds very strong there. I'm also going to take the pulse on your neck here real quick, so just stay still for me. Good. Good. Wonderful. You doing okay? I know, but we're going to be here for a while, so you might want to relax and get comfortable. So why don't we listen to the old heart there? Gotta make sure that is in proper working order or we have a real problem on our hands. It's all gonna be a-okay though. So just relax. And I'm gonna come in real close and take a listen. And here we go. Just breathe normal for me. Okay. Just keep breathing. Just looking for any kind of abnormal palpitations, arrhythmia, things like that. I'm not hearing anything bad so far. Well, my friend, your heart sounds wonderful. But while I'm here, I want to take a listen to your lungs and your stomach as well to make sure everything else sounds just as good. So if you wouldn't mind, I'm just going to part your gown a little bit. Thank you. And I'm going to come in real close and we're going to take another listen, okay? Okay. Alright, so come in real close and I want you to just breathe normal for me. Good, good, good. And breathe again. Good. Breathe again. Good. I'm going to reach around the back here. Regular breath. Good. I just want to take a listen, listen, listen. Good. 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 Well, my friend, your heart and lungs and your stomach sound absolutely wonderful, but I would like to do a little more in-depth abdominal examination on you since it has been a while. So what I'm going to do is I'm going to press around on different areas of your abdomen, and then I'm also going to percuss, just like this, gently around your abdomen. And you're going to let me know if any of it hurts, okay? Okay. So I'm just going to come down here to your stomach and press, press, press. Any pain? Okay. Press, press, press. Good. Press, press, press. Good. Press, press, press. Good. And now for some percussive. Good. 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 Wonderful. And one more. Great. Well, I have to say, I don't think there's anything wrong with the old ticker or the rest of your abdomen right now. Looking pretty good. So we can go on to the rest of the exam. So for this part, I'm going to be doing a general face examination of you and continue to look at your scalp and just a general facial examination. Make sure there's nothing outwardly wrong that I notice, okay? So I'm just going to scoot up real close to you and come up here, and I'm going to be looking at your scalp. Just going through your hair a bit. Just want to make sure that everything looks good, good, good. Okay. Wonderful. Absolutely wonderful. Good. Well, your scalp looks great. Hair doesn't seem to be thinning, more than I can say for myself, but it does look great. So, whatever you're doing, keep doing it. I just wanted to take a look at that face, so why don't you just look straight at me. I'm just going to come up here gently. Palpate around the face. You let me know if there's any pain. How the sinus has been. You got a little history of sinus infections. Anything bad this winter? Good. Good. Lift your jaw for me. I just want to feel those lymph nodes. Okay, lift your neck for me. I'm just going to press gently on the side of your throat here. Okay, good. Wonderful. Alright, my friend. Everything seems pretty good so far. Let's get in a little closer. I would like to take a look at your eyes, do a quick eye exam, and then we'll look at your ears and your nose and your mouth, and then we'll get you out of here. Alright, so just going to turn my little light on here, and I'm going to scoot up real close. I'm just going to open that eye, and I'm just going to look inside and see how everything looks. Why don't you go ahead and look up for me? Good. And look down. Good. Left. Good. Right. Good. Wonderful. Same thing over here. Just gonna open. Take a look inside. Look inside. Why don't you look left for me? Good. And now right. And up. And down. Good. Wonderful. Your ocular nerve looks beautiful. However, just because something looks good doesn't mean it works well. So we're going to do a few quick eye exams on you, starting with something super simple. I would like you to look right at me and just follow my finger. Both eyes. Follow. Good. Good. And this finger. Good. This way. Good. This way. Good. And I want you to do the same thing, except this time we're going to look at my little light. As you can see, not too bright. And I just want you to follow. Good. Follow. Good. Keep following that light for me. Good. Keep following that light for me. Good. Great job. Good. Wonderful. There you go. Great. Alright. And now we'll do a little pupil response where I'm going to cover one eye and swing the light in and out and in and out and in and out and in and out and in and out. Good. And we're going to do that on the other side. And in and out 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 and in and out. Wonderful. How are your eyes feeling? You can go ahead and blink. That's okay. Now, I would like you to follow this little eye chart here. So if you wouldn't mind reading each letter that I point to. Here, and here. And this one. Good. How about that. Good. That. All the way down here. Can you read this last line for me? Good. This one, and this one. Wonderful. And just to make sure that those eyes are 100% intact, let's do a couple quicker tests. So this is going to be color recognition. I'm going to hold up a color swatch, and you let me know what color it is. Alright, here we go. White, wonderful. Purple, good. Blue. Green, good. Yes, that's yellow. Kind of orangey though, but good job. That's the orange. Good. And red. Wonderful. Well, color recognition is on par. Your eyes look wonderful. So, I'd say we're all set there. Why don't we take a look at those ears of yours? Okay. Just going to grab my otoscope real quick. Put the attachment on. Just like that. So I'm going to be taking a look in each ear and doing a few quick hearing tests just to make sure everything's a-okay. And I'm going to do a quick ear inspection first. So I'm just going to look over here. Just going to gently touch your ear, different areas. You let me know if you feel any pain whatsoever. Good, 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 good. And how about on this side here? Let's take a look. Just palpating around, okay, yeah. Alright, well the ears look good. So let's take a look inside, shall we? Just gonna turn the light on, and we're gonna slip the otoscope in, so gently, and take a look. Alright, good. Oh, I see the few white ear hairs in there, but hey, that's okay. Otherwise, looks pretty clean. That's what I like to see. Good job. Keeping that ear nice and healthy. And the other side here, same thing. Just gonna slip the otoscope in gently. Good. Good. Wonderful. Ears look wonderfully clear. And everything's good inside. So why don't we do a quick hearing test, and I'm just gonna ask you to close those eyes for me. And I'm gonna whisper a word in each ear, and you're gonna repeat it back, okay? Alright, here we go. Close those eyes. Football. Good. Baseball. Good. Whiskey. Good. Relaxation. Wonderful. Alright, go ahead and open those eyes for me. I'd have to say, I think your ears are a-okay. I would like to keep looking at the rest of you though. And we're going to take a look inside that nose. It's going to be real quick. Alright. New clean tip. Now go ahead and tilt your nose back for me. And here we go. Just gonna look inside. Make sure I'm not seeing anything clogged or any inflammation. Good. Let's take a look on the other side here. Good. Oh, also looks very good. Great. Alright, my friend. I would like to take a look inside your mouth, so if you would be so kind to open up and say ah, so I can take a look inside. I just want to check for any redness, any seriously bad oral defects, but overall everything looks pretty good. Uvula looks good, throat doesn't look red or splotchy, teeth look relatively clean. Okay, good. Wonderful. Well, my friends, so far so good. I would like to take a look at your reflexes real quick, and let's talk about your reproductive health for a little bit. Has everything been going all right there? Okay. Well, based on your age, might be good to maybe look and get into a specific checkup for that, but we can make you a recommendation. But for now, why don't we take a look at those reflexes? So I'm just going to grab my reflex hammer here, going to bend down, going to get that one knee, 1, 2, 3, pop, good, and the other knee, 1, 2, 3, pop, good, see, real quick. Alright, my friend, so for the final portion of this exam, I would like to do a sensation test, just to ensure we're being very thorough. So I would like you to just close your eyes. And I'm going to be either touching you with a object we can call sharp, and an object we can call dull, Okay? So why don't you just close those eyes for me. And we'll get started. So, here we go. And touch. Dull, very good. Touch. Sharp, very good. Touch. Dull. Touch. Sharp, good. Touch. Dull. Touch. Dull. Touch. Sharp. Touch. Sharp. Touch. Dull. Touch. Sharp. Wonderful. You can go ahead and open your eyes now. Well, my friend, I think everything looks absolutely great and you're perfectly healthy. But I would request that you do make an annual appointment with us. And we would like to get you in to see that specialist to maybe take a look at your reproductive health, just as a checkup. Alright? Wonderful. Well, do you have any questions? Alright. Why don't you take it easy the rest of the day? Relax, drink plenty of water, get a good night's sleep tonight. And if you need us, just make another appointment, and we'll see you soon. Bye-bye.